Imagine doing more for your lower back and hip pain in the next 12 minutes than you have in the past 3 months with medical appointments, medication, and heating pads. If you have pain that's moving across the lower back, and when it gets really bad, it's coming across and down the outside of the thigh, this video is for you. And the cool thing about this is you just need a little bit of floor space and body weight, or you can even do it on the bed. You don't even need to get to the floor. And I'm going to show you exactly how to reverse engineer the solution for this type of pain. Now, this pain pattern of lumbar facet syndrome with hip bursitis and possibly IT band syndrome, I see all the time in the clinic. So I wanted to come on and shoot a quick video for you guys and show you exactly how I tell my clients to heal themselves from the comfort of their own home. So if you're on board with that and find value from this video, go ahead and smash that subscribe button and let's get to work. Okay, so the first exercise we're gonna jump into is called a pelvic tilt. Now, about 1/8 of the world has back pain at any given time, and across that lower back, L4, L5, and L5, S1 are the most common segments. I've never heard a neurosurgeon or an orthopedic talk about controlling the pelvis. The pelvis, your two ilium on the side, and your sacrum is in the center, that's your tailbone. The sacrum is S1 through S5 technically, but if you control the pelvis, you control the lower back. So let's go. So lying on our back with our knees bent, what we want to do is have our hands right on the front of the hips and kind of make a C shape here. This is just going to give us some help in understanding what the pelvis is doing, not necessarily do the work with our hands. I actually want you to do the work with your pelvis. And the first maneuver is to roll that pelvis backwards and then roll the pelvis forwards. Now we're going to stay through our pain-free range, and we're going to go for about 10 repetitions and allow this to open up. Just allow your body to continue to work with time and energy. Now, as I go through these reps, I want to tell you that the most common issues with this are, one, it's kind of hard to control. It's a different movement. I'm actually not tightening the core, and I'm not pushing with my legs or glutes. You'll see a lot of people try to lift the bottom, and you just want to roll that pelvis backwards and then roll it forward, allowing it to open up with time and repetitions. All right, beautiful. So there's one set. In between our sets here today, we're going to take some time to just rest and breathe. Take some nice big diaphragmatic breaths. Exhale fully. Again, you can do this on the bed, you can do this on the floor, whatever's comfortable and feels right for you today, no problem there. You're going to get the same great result. So jumping into set 2, if you need your hands for a little bit more support and guidance, feel free. If you feel like you've got it under control and you've got that pelvic control, then go right ahead and start working through there. So you saw that we only took about a 30-second break in between our sets. It doesn't have to be crazy long, but taking that little bit of a break in between your sets is very important. And as we go through this, you've been hurting for a little bit here. Give your body the time and attention it needs. Don't rush through these exercises as quickly as possible. I know you've got a million things on the to-do list, but your body's going to thank you, and you'll be able to sleep better tonight after you do some of these exercises and allow things to open up. Okay, I think that's about 10 there, pretty close. So 2 sets of 10 is what we're going to go through for some of these early mobility exercises. Next are called knee rotations, and they're exactly what they sound like. So we're going to bring the feet together, knees touching, and allow the knees to move to the side. You'll feel a stretch through the hip and the lower back there, and then allow them to go to the other side. As I'm going through and finding my 10 repetitions, we're going to allow it to open up, but I'm also stacking the feet. So sometimes people do this number and allow the feet to kind of stay. I find that I get a better stretch when I allow the foot to come onto the top and back to the other side. And again, working on your breath as you find that stretch. Inhale, exhale. And we're breathing for a couple of reasons. Number one, our tissues need oxygen to heal, right? They need oxygen, they need blood flow, they need time. Those are just 3 essentials. But we're also breathing because oxygen is a natural pain reliever. And what do we come here today to do? Relieve that pain, absolutely. So keep on breathing. You can hyperoxygenate the body. aka just breathing a bit more mindfully and a bit more consistently. There we go, that's about 10. And that's gonna really help you to get that oxygenation into your tissues, drop your acidity level, so drop that pH and become a bit more basic, a bit more alkaline, and lowering your levels of inflammation and obviously pain, as we just said. So such good stuff there comes from simply breathing. And who doesn't love to multitask these days, because we're all busy. Ready for set 2? Here we go. All right, so we can already start to feel things open up here a little bit. That lower back needs to move. All the joints of the spine and the body move in 6 directions, and that's really great to allow them to open up, first forward or backward, and then rotation is a really great direction to go to next. And usually I go side to side last if need be. And if you have any questions about these exercises, or you just want to tell us how you feel afterwards, don't forget to hit those comments below. And 10. Here we go, last one. Okay, fantastic. Good work, guys. Our next exercise is called an open book. So we can have a pillow here, or we can just use our arm. There are 2 styles that I like to go to. The first set I'm going to do with the easier version. The second set I'll do with the harder version. Do what suits you best here, and always stay pain-free. So for the easier version, we're going to bring our hand to our ear, and then we're going to allow our torso and ribs to come forward to find a little stretch, and then open up here and find a little stretch. So we're going back and forth, as we talked about, rotating that spine. And as we speak about rotation, this video is specifically for lumbar facet syndrome. So that's irritation of the small joints within the spine without pain, without nerve pain, or a disc bulge going down the leg. Now for my disc bulges, if we have gotten that pain to come back up to the lower back, and we're really starting into that process of opening up the spine, these types of things are okay. But they tend not to be the first things that I go to for a disc herniation or disc bulge, especially to alleviate sciatica pain. Those are going to be in different videos, so go ahead and click on those. They should be popping up right around here. Couple more here. Bonus points for, again, adding breath at that open position. Get those ribs to expand. Exhale as we close. Last one. And back home. Beautiful work, beautiful work. Okay, so that started opening up. We started noticing a little bit more motion, a little bit more pain-free movement, and we added our breath there. So good work. I would go back to my other side here, but I don't want to turn away from you guys here. So if I was going to go for the more in-depth version, a little bit harder, we're going to lengthen our lever. And so what we'll do there with our arm is now I'm going to reach forward, pull back, and bring my shoulder blade back in together. Open from the ribs there. And always bring your nose with you. A lot of people like to keep their head at the same point here as we're moving. Boom, bring that shoulder blade back, taking that nose with you. So nose in line with the center of the chest, allowing the shoulder to open. The other thing that I find clients do here is throwing the arm back without moving at all, right? So the nose staying steady and it becoming a total shoulder motion. When I'm really trying to affect the ribs here, moving forward and backwards, opening into that right and left bits of rotation. Here we go. And you want to make sure that that lower body stays steady and that you're not creating any discomfort in the lower back here. Always pain-free. No pain, all gain. That is one of the rules that I live by as we're going through this injury rehab process. There we go. Okay, feels great. Okay, next is a half kneeling hip flexor stretch. I'm going to show you from the front and the side so you guys can get the best view of this. But what we're going to do is come down to kind of a kneeling position, one leg down, one leg up. If you need a little bit of support for balance, because this is an interesting position to be in, absolutely, this is not a balance exercise. What I want you to do here is use your pelvic tilt. So you're gonna posterior pelvic tilt, you're gonna go backwards, almost lifting your belly button. I like to bend my back toes here to make sure that my foot, knee, and hip are in line as I get that posterior pelvic tilt, and then I'm gonna engage my affected glute. So the downside leg, I'm gonna push that hip through, and I'm not just going forward, I'm gonna come up and across here lightly, just towards the opposite window and wall here in the room. So up and away ever so lightly. You notice I don't need to turn my torso extravagantly. I don't need to lean back. And the other thing I see people do is really like lunging forward with that little pelvic tilt and glute activation, a little bit of a turn, pushing. If I had an arrow, I want it to go right up here, almost at that kind of 120-degree angle. That's your hip flexor stretch right there, guys. And once you get this, you can also do this in sitting and standing. So we're gonna hold this for about 30 seconds here as we breathe and just maintain. You want to hold stretches for 20 to 30 seconds because you need those deeper fibers to get into the stretch. 5 to 10 seconds just doesn't seem to be enough, and that's not what the research supports. So research-based here, 20 to 30 seconds is where you're gonna get your optimal soft tissue extensibility. So that's great there. Don't forget to do both sides here. So we'll do a couple sets on both sides. Again, toes flexed if you can. If not, that's okay. The other way to get a little bit more out of this, so my heel, knee, and hip are in line here. However, if I want to get a little bit more, I'm going to bring my foot out so that the hip rotates in lightly. Again, pelvic tilt, glute activation, bring that chest up, and I'm trying to drive my hip up and away there as I maintain that stability for 30 seconds. Feel the length. You're probably getting it right up in the front of the hip. That's your hip flexor or your psoas muscle. And then oftentimes we'll get it down the front of the thigh there too. And so great stretch there. It's the exact same thing if you want to do this in standing as well. So we can bring that toe in a little bit, pelvic tilt, glute activate, and raise that chest. Super easy. Simple to do anywhere you have time for. So let's go ahead and hit the other side here. So we're doing this together. Pelvic tilt, glute activated, chest up, pushing from the side lightly. We're going to count down 30 seconds there. Nice and steady. Don't forget to breathe there. Enjoy that stretch. Enjoy knowing that you're doing something that's going to help you to feel better and move better and get through the day being pain-free. The nice thing about this routine is you can do it anywhere, anytime. When you get good at the pelvic tilts, you can do them in sitting or standing. They're actually one of my favorite things to do on a long car ride. Or if you're traveling by plane, you get stuck there for 2 or 3 hours. We really want to make sure that we're comfortable as we go through the travel so we can enjoy it. That's why we travel. That's what we like to do, especially if we're spending time with family and loved ones. So use those pelvic tilts. And then the next exercise I'm going to show you can also be done in a chair or while traveling. So stay tuned for that. 5, 4, 3, 2, 1. And the last exercise we're going to do is a thoracic cat cow. Now your thoracic spine starts at the base of the neck and goes down to the base of the ribs there. So it's a really big chunk of 12 vertebrae that your ribs attach to. And my thought is that if we loosen up above and below, so we did a little bit of hip work, we did a little bit of thoracic spine work, and we did a little bit of lower back work, that's always such a good combination for lower back and hip pain. So here we go. We're going to keep the elbows unlocked, knees shoulder width apart. Right here, we're going to push the shoulder blades up towards the ceiling, kind of push that floor away, and then allow the shoulder blades to come together as that mid back dips, not necessarily the lower back. So with the traditional cat cow in yoga, the head likes to lead and the tailbone likes to lead. In this sense, I really like to focus on that mid spine. So as we push up, we're going to inhale. Good. And then we're going to come down, allow those shoulder blades to come together. A lot of people end up bringing the shoulder blades up towards their neck. Allow them to come right into the middle of the back there. If you're a lady, right across the bra line is a great place to shoot for. Guys, lower shoulder blades is what we're looking for. If your wrists or knees don't tolerate this, it is totally okay to go with fists there or add a pillow to the knees. And the other thing we don't want to do is to totally dip at the elbows, right? This is missing that thoracic mobility. So it's okay from the elbows to move a bit. Just don't have most of your motion coming through those elbows. Good stuff. And again, we would do 2 sets of 10 there. So after our 30-second rest, we're going to jump into set 2 here. Again, allow your body to move through the pain-free range. Now these exercises are all designed to loosen up all the joints above, below, and around those pain points. And I really hope that we can identify those and help you move forward here. If you feel like there's something else going on that you just need a little help figuring out, go ahead and get my free guide to a better diagnosis. That's got the most common special tests with the most common pain patterns and diagnoses that I see in the clinic. It'll help you differentiate from home from a lot of different issues, and you can do it for free. So that link is in the description below. There we go. All right. Okay, guys, I hope that was super helpful for you. Just a few simple stretches from the comfort of your own home. And let me know in the comments how you feel now as you walk around, move around, and I hope you go about and have a blessed day. Thank you so much for watching and being a part of this channel. Take care.